Castillo, the Director of Business Development with Joliet Area Community Hospice and Palliative Services. And today we're going to go over what the admission and referral process is when sending a referral over to Joliet Area Community Hospice, as well as how we handle it once we have it, and then how we care for that patient as we move forward with hospice or palliative care. Today I have with me Sherry Lindstrom. Sherry, welcome. Thanks for joining us today.
Thank you for having me, Mary.
Yeah. So give us a little background on you, Sherry, on your experience here at Joliet area.
Well, my name is Sherry Lindstrom, and I'm a nurse community educator with Joliet Area Community Hospice. I've been with hospice 15 years now.
Wow.
Did some work early on with admissions, so it is a very important piece.
Yeah, absolutely.
So we're going to talk about that a little bit today, Mary, and get your thoughts. The first question is, how does a doctor do a referral to help us be able even to talk to a family, whether it's from his office, whether it's from the hospital? How does that start?
Yeah, so we can receive a referral via phone call or via fax. If you have a patient in your office and you feel that hospice or palliative would be a benefit to them, you can call us directly and send over any information from that. If you're rounding at the hospital and you feel as if there's a patient there that really needs help or needs support and needs that discharge plan home with hospice or palliative, again, you could call us directly. Our goal is always to do same-day admission. So you give us that call, we receive that referral, we reach out to that power of attorney, we reach out to that patient if they're decisional, and we help set up that time. So it may be coming to the hospital, it may be meeting them at their home. We can do that wherever they need us to do that at. And again, our goal is always within that same day, because we want to get that help and that hospice benefit into their home as soon as possible.
And Mary, sometimes we find that people have their loved one come to the hospital, they're in the emergency room, and the doctor, even there in the ER, knows that between him and the family, they realize that they really are looking for comfort care, hospice care. And can they start that even in the emergency room so they're not admitted and worked up?
Absolutely. So a lot of times our families will call 911 out of panic and not knowing what to do, and maybe not even having that experience to know how to care for their loved one, but again, more of the reassurance that they have the support. So oftentimes doctors or nurses will call us directly from the ER to see, is this person eligible? You know, they know that that patient does not want to be admitted. They don't want tests. They don't want that full workup. And they really just want to be home and stay comfortable. So they'll call us. We can send a nurse out directly to the ER to help with an assessment and get everything that they need home. Maybe we need to order a bed. We need to get their medications out there. We need to get a lift out there. All of that equipment and medication we can have at the home waiting for them when they discharge from the ER.
That sounds real good. So then, what's our availability for the doctor to be able to call us? Are we open 24 hours a day? Explain how that works.
Yeah, we operate 24 hours, 7 days a week. So we can come out at any time to wherever that need is. So if it's meeting the family in their home, if it's getting them to our inpatient unit here in Joliet, or if it's to meet them in the ER or even the doctor's office, or don't forget about our skilled nursing facility. So you could be rounding at a skilled nursing facility and notice that they are beyond that scope for that skilled piece and really need hospice and or palliative. We can send somebody out. Absolutely, 24 hours, 7 days a week. Our team will have a routine staff that helps care for them, but with the admission process, we can send somebody wherever, night, day, weekend, or holiday.
And what does that admission process include when they go over to the house or the nursing facility and work with the staff there, or a memory care unit, or wherever? We will go wherever, we know that. So what's involved then when they go to do an admission? Do they need the family?
As long as the consents are signed by the power of attorney, if that patient is not decisional, then we send a nurse to do a full assessment. So they'll do a full assessment of that patient. And then that nurse will reach out to you as well to obtain that CTI, that certified terminal illness. And they will manage anything that they need to keep them comfortable. Whether it's certain medication, it's equipment such as a hospital bed or a wheelchair. Again, that admission nurse really takes over that start of care in the sense of driving the bus, essentially. What does this patient need to be safe and comfortable?
And that sounds real good to me as a doctor, knowing that my person is going to be under hospice care. But when they're there day in and day out, what is involved with that care then ongoing, and am I aware? of how they're doing.
Absolutely. So every patient has the right to keep their primary or a specialist in the loop of everything. So when they share with us who that physician is, maybe they've been seeing you for 15, 20 years and they want to keep that, we welcome that. You know that patient. We want to support you and support them. So sometimes it's just managing because you don't do home visits. So you can remain part of that role for as long as you would like to. If you choose not to because you don't round in to see home patients or you don't go to the nursing home, that's okay too. We can manage that patient's pain, symptoms, and how to best address what's going on at the time. So once the admission nurse handles everything that she needs to or he needs to, it's hand over to their field team or their field staff. So that's made up of a case manager, an RN, a CNA, a social worker, a chaplain, and then we also have multiple complementary therapies that can help them through that journey as well. But the idea is to get on a routine schedule. So the nurse will come out, the CNA will come out, the social worker and chaplain. Now, as we start to see a decline or maybe a change in condition, we can always add more visits to that. Now, even though we're not in the home 24 hours, 7 days a week, they still have access to us. So sometimes it's as simple as a family calling in the middle of the night as a reminder or encouragement that they're giving the medication as the nurse instructed, or if they're turning properly or a new symptom has arisen and they want to address it. Sometimes it could just be handled over the phone with our nurse that's on call 24 hours, 7 days a week. Or it may be something of a little bit more of a higher need, so we will send someone out, again, also 24 hours. So although we're not in the home, you have full access to us as the patient and the family as well as the physician.
That sounds good. I think the doctors appreciate knowing that.
Yes, absolutely.
Mary, I do find that sometimes the doctors are concerned about how will this be paid for because they know their people.
Yes, absolutely. I think sometimes people delay the idea of care, going to the ER or coming to hospice because there's a fear of what the cost will be. So hospice is covered 100% under Medicare Part A. It's also covered under Medicaid as well as some private insurances. At Joliet Area Community Hospice, if a patient does not have the proper payer source, we will not turn them away based on their inability to pay. So as long as they still meet the eligibility for hospice, we will make sure that they have the care that they need.
And doctors would appreciate knowing that.
Yes, knowing that and you're in good hands and the fact that there's not going to be that fear of them receiving a bill down the road.
That's great.
What's most important to us is that we have individualized care for not only the patient and the family. So it's not the disease we're helping, it's the patient that we're helping. So we can alter or adjust what is best for everybody. Some patients don't want a CNA, so we'll respect that. Some need a CNA more, so we'll do our best to help that. Some welcome spiritual and emotional support, some don't. So we really focus on what's important to the family and to the patient. When we admit a patient, our very first question is always what's important to you. Is it important to get home and die at home? Is it important to not go home and die because that's where their loved one lives or they have small children in the house? We really focus on what's important to them. And we're very fortunate to have so many great relationships in this community throughout all of the counties that we service for, helping with placement. We also have our inpatient unit. We can help with respite stays. We can help you find a caregiver for when we're not there. So we're more than just that clinical piece. We offer an all-around package per se of being able to guide or provide resources to the family. So I'm sure many of you have seen Sherry going through the hospitals or stopping at your doctor's office as well as me. She's a little more popular than me, but we really welcome the idea that if you have any questions, you can reach out to either one of us or always call our main number. We're 24 hours, 7 days a week. We can provide education to you, your staff, or if you feel that you have that patient that you're just not sure about, whether they're not maybe open to it, or you're just not sure based on that diagnosis if they're eligible, call us. There's no fee for us to come out. If they're eligible, we can help support that process. If they're not, we can explain why they're not and maybe things to look for that may get them or may present that they'll be eligible in the future. So Sherry, thank you so much for coming today to talk to the physicians with me, and we'll see us both around.